Hello, my name is Dr. Fernando Rojas-Vizcaya. I am originally from Colombia, but I am living in Spain, where I have my private office and I have my institute, is the Mediterranean Prosthodontic Institute. I am living in Castellón. It's a small city very close to Valencia. It's right in the Mediterranean. I am working for more than 20 years with dental implant. I am oral surgeon that I study in Spain in the University Complutense of Madrid. And after 10 years working with dental implant, I study prosthodontics. And I received my master's degree in prosthodontics in the University of North Carolina at Chapel Hill. So my lecture for today is about monolithic zirconia for fixed detachable restoration. It's a new concept working with this type of material and doing this type of restoration. The basic idea is to avoid the chipping in this type of restoration. If we make a restoration in 100% zirconia without feldspathic ceramic, so we don't have the chipping because we don't have feldspathic ceramic. So normally we are working with fixed detachable restoration, normally in metal acrylic or metal ceramic or zirconia ceramic. So if we are working with metal acrylic, you know that one of the problems that we can have is the wear of the denture teeth, the bonding of the denture teeth, or the fracture of the denture teeth. If we are working with metal ceramic, one of the main problems could be the chipping or the fracture of the small pieces of the ceramic. If we are working with zirconia ceramic, one of the problems could be also the chipping or the fracture of the small pieces of this feldspathic ceramic, or in the worst scenario, the fracture of the distal cantilever. So this is one of the ideas to work with monolithic zirconia, full restoration made 100% in zirconia without feldspathic ceramic. The idea is to avoid the chipping of the ceramic. So speaking about what I am doing with this type of restoration, the main point that I can give to this material is avoid the chipping. This is very important because dentists working with this type of restoration, fixed detachable, different material, we know that after we deliver our restoration, maybe everything could be perfect, great. I have many restoration in different material working very good, but I have some problem with, I am working with acrylic, metal ceramic, metal zirconia ceramic. So one of the best points that I can give to this type of material is avoid chipping and reduce the retention of plaque because it's zirconia. It's a very good material, good biocompatibility with the soft tissue. Okay, I need to recognize that in the United States, the culture about oral hygienic is very high. Here you can see a lot of white teeth, beautiful smile. Patient take a lot of care of his teeth in the United States. And in Spain, we can see one group of patients that maybe they don't take a good care of his oral hygienic. Patients smoke a lot in Spain. So we can find a population where for dentists is a big group of people where we can apply our knowledge. I think that people in Latin America have similar culture about oral hygienic similar to the United States. So I am passionate from the dentistry, so I spend most of my time working in my institute or teaching around. I am working in different universities in Europe and in the United States as a visiting professor or adjunct professor. So this takes most of my time. But now, one important part of my life is my family. I will have my first kid in 1 month and a half in Castellón. So we are very excited about this situation because we expect to change my life. And together with this, I spend my time just in my home. I like to read, or I like to ride my bicycle and running. This is where how I use my time.
For more education programs, visit the Guide Institute at www.guidedental.com.